Okay, so the first range of motion assessment that I'm going to go over for the final practicum is going to be dorsiflexion. So for this assessment, what I'm going to have my patient do is sit supine. So they're going to, they can either lay down all the way on their back or you can have them seated. I just want their hip and knee extended and then the heel of their foot coming off the examination table. And from there, I'm going to take my goniometer and I'm going to place the application head, so the big circle, in the center of the base of the foot. So kind of that heel area. And then I'm going to place it on the outside of their foot so that way my measuring head can align with the fifth metatarsal, so right down the middle of the foot all the way to the top of the fifth toe or the little pinky toe. And then I'm going to have the short head and the stationary head in line with the fibula, so running down that lateral side of the leg. And then so things that we're assessing dorsiflexion, and then we're also assessing range of motion in the talocrural joint. Some muscles that we'll be assessing with this are the gastroc, the soleus, the posterior tibialis, and then all of the extensors of the digits. The flexors of the digits. And then some underactive muscles. So if something were to go wrong and you see compensations like foot flattening or turning out of the foot or the heel raising, just so that way they could get to that range of motion, then we're going to call that a compensation, and we're going to start to look at muscles that may be underactive, which would include the anterior tibialis and those extensors of the digits. And then our optimal range of motion goal here is 70 degrees. So what that would look like on our goniometer. So the stationary head is in line with the leg. We're going to passively put them through dorsiflexion until we see any compensations. And then that is the 70 that we will read there. So this is what optimal range of motion would look like for dorsiflexion.